Hi, everyone, and welcome to our monthly research briefing. I'm Vanessa Weisbrod from the Celiac program at Boston Children's Hospital, and this month we're talking about a new paper that looks at lost work time as a result of having celiac disease. As usual, we have our Director of Research, Dr. Jocelyn Silvester, here to answer your questions about the paper. So, Dr. Silvester, what did the study find? Did people with celiac disease actually miss more work than people who don't have celiac disease?
So that's a good question. And the answer is sort of yes, but not really. And so I think it's a little important to understand what this study was about to understand the answer to that critical question. And so this is a study where they looked in Sweden at people who had a biopsy confirmed diagnosis of celiac disease. And one of the things about Sweden is that they were able to get data on people's days missed from work. So they took the people of working age and they looked at a group of patients with celiac disease who had biopsy confirmed celiac disease and then matched them based on their age and their sex. So they were getting relatively similar people and compared them to the other people in Sweden who didn't have celiac disease. And so what they found was when they looked at the whole group, the people with celiac disease had more days of missed work. But most people with celiac disease had no days of missed work. And so it was really just a small proportion of the people who are responsible for most of the difference.
So do we know anything about this population of people that missed work? Were they calling out sick from work because they had symptoms that were related to undiagnosed celiac disease? Or were these people that were having a reaction to eating gluten?
We don't have that level of data because this was a study where they couldn't ask tens of thousands of people why they missed work. So they had to look at a database that keeps track of people who miss work and link that to their health records. What they were able to do was look at people who had a follow-up biopsy and compare those whose follow-up biopsy was normal to those who still had damage.
And was there a difference between those groups?
No.
And do we know anything about pre and post diagnosis? Were the rates between those groups any different?
They were, and before diagnosis, there was a higher rate than other people. And that did not necessarily go back for the overall group to the average population rate. But I think what's really important to remember here is that when you take the group with celiac disease also comes with other diseases. And so sometimes it might be that it's their type 1 diabetes that's keeping them out of work and not their celiac disease. And they didn't have information on other diagnoses for these patients. And so one could expect that perhaps the people who have celiac disease, we know they're probably more likely to have type 1 diabetes than those who don't. And so this is part of the reason why it's really hard to make these comparisons, because there's so much that goes to make a person and not just their celiac diagnosis.
Absolutely. So can we look at this paper and in any way relate it to kids going to school? Would we expect to see similar things in terms of attendance rates with kids with celiac disease in school?
Yes, I think probably the expectation would be the same because we know that most people have a response to a gluten-free diet and then are able to participate just like other children. And that's really our goal for our patients. One of the things that was interesting was that when they looked at the folks who were missing more work, the proportion was about 25%, although it was really 7% of the total who were really missing most of the work. And 25% is about our estimate for people who have non-responsive celiac disease. And so the authors thought that this might actually relate to symptoms when you looked at that sort of quarter of people who are more than the general population. But it's not our expectation that celiac disease would regularly be a reason for children to miss school. And if it is, it's really a reason to see your gastroenterologist.
So what is your best advice to people listening today who have celiac disease or have a child with celiac disease about not missing work or school?
That's a great question. Obviously, people shouldn't go to work when they're sick, particularly if they have infectious diseases. But we also know that gluten exposures happen and that these can cause people to have symptoms that make them unable to go to school or unable to go to work. And so I think what's important is that the frequency of these symptoms should not be something where it's impacting performance or being a notable impact on attendance. If it is, then I think that's a reason to check in with your healthcare providers and really have a good look at what's going on. It may be that there's some gluten, or it may not be gluten at all, and maybe there's another diagnosis that needs to be made. So I think it's really important not to accept that having celiac disease necessarily means that there should be more missed work or school.
So you bring up a really good point in the era that we're in, and with the new variant of COVID having one of the main symptoms being diarrhea, how can families sort of differentiate, and what precautions should they be taking if their child is having a lot of diarrhea right now, and determining if it's a gluten exposure or potentially COVID?
So I think another thing that's happening right now is that people are at home more, which is fortunate because it makes the gluten detecting sometimes a little bit easier. And so I think if there's a clear gluten exposure and a clear COVID exposure, that's where it's the most difficult. If there's a clear COVID exposure and diet has not changed, then I think COVID needs to be higher on the list. And that's part of the reason why hopefully there's access to testing, either PCR testing or lateral flow tests. And if there's a clear gluten exposure and no COVID exposure, then gluten's probably more likely.
Great. Well, thank you so much, Dr. Silvester, for taking the time to explain this paper to our patient families. We really hope that everybody enjoyed today's briefing, and we will be back again next month.
Thank you, and everybody stay healthy and safe.